Right. Okay.
Okay.
Right.
Tell us when we go, Asha.
Okay.
We've got 20 participants now, everyone. It's up to you if you want to go for it or we want to wait for a bit.
Go
All right,
live.
go then. Go live.
Hi.
Hi, everyone.
Hi, everyone.
Good evening. I'm Dr. Alan Down from Multimedia University and from the Contact Center Association of Malaysia Executive Committee. And I'd like to welcome you tonight to our CCAM forum entitled Coronavirus, COVID-19, the COVID-19 Crisis and Call Centers, What You Should Know. It'll be my privilege to be your host and your moderator for this evening. And I think this is an event that is of considerable importance to all of us in the contact center industry. We have never seen a period in Malaysia or around the world that similar to what we've faced over the last 2 weeks. The rapid onset of a disease, that we've never seen before. The one about which we are still very uncertain and about which there are very few answers. It's something that has rocked the country and rocked the world. This disease has special implications for the contact center industry and for each of us living, in the workplace, at home, anywhere. To help me unpack some of what we do know about the current situation and about the COVID-19 coronavirus disease, I'm so pleased to have a group of experts join me this evening that will speak to various aspects of the problem that we're facing. Let me introduce them to you now. From University of Malaya, the Social and Preventive Medicine Program, Professor Dr. Victor Ho. Victor has an extensive background in occupational health. He's an occupational health physician and also in the public health discipline. He'll be joining us to talk about those areas today. Also joining us is Norhana Nawawi Sari from Faramanagiana for Logistic, the main provider of pharmaceuticals in Malaysia. Hannah is a pharmacist of about 20 years experience and also the director of general manager of customer service there. So Hannah will be able to speak to us about contact center issues as well as share her expertise as a leading pharmacist. Also, Dr. Maguntan Marugan, who is a primary care physician, also a holder of a finance degree. Dr. Mugan is an expert on primary care medicine and particularly on health and wellness, and has consulted in contact centers on those issues. He also can speak to the business aspects of what we're facing as an industry and what different firms who are members of our association and who are not are also facing. My background was originally in psychology and community psychology. I spent a period in the Arctic as the director for community mental health services, and for the last 20 odd years I've been teaching management at various universities throughout Malaysia. I'm now a research fellow with the Multimedia University Business School. So that's who we are, and we hope to get to know you over the course of the next hour. A couple of things to remember. First is that you're very welcome to submit questions at any time. We may not be able to get to all the questions over the hour that we spend together, but those that we don't get to, we will take and we will prepare written answers to. And if you want us to, we can forward those back to you by email. So when you're submitting a question, please, and you want to make sure to get an answer, whether it's live or a follow-up answer, please be sure to add your email address to it. Also, it would be interesting to know from where you're connecting with us. This is the first time we've done a totally an at-home webinar. Please feel free to let us know where you're connecting from, what city, what country, and let us know as well if you're watching with someone else and how many people are there with you, so that we get a sense as to how many people this broadcast is touching and reaching. With that in mind, then let's jump right into the issue. Victor, Professor
Yes.
Victor Ho.
How are you, Alan?
Good. It's nice to see you here.
Yes, nice to be here. Right, but not here. It's right to be in my house.
Yes, yeah. Well, that brings up another issue. We've never done this before. When we've broadcast, it's always been from the CCAM headquarters, and we've been joined from people's offices. But like most people in Malaysia, we're all working from home today, and so this is a new experience for all of us. Having said that, they may lead to a few technical problems as the hour wears on. Please bear with us if it does. Victor, what is coronavirus? And we hear a lot of terms kicking around now. We hear SARS coronavirus ID 2019. We hear COVID-19. What is the difference between those? Is there a difference between those? Is this SARS?
Basically, coronavirus is that we are facing now is the type of virus, same virus that SARS is, same virus that MERS-CoV is. Basically, all of these are the same group of viruses. All right. So this is a new virus coming out from Wuhan. So to make sure that it is not too what we call that it's more global in the name. So WHO has decided to name it coronavirus, which is basically CO is coro, VI is virus, D is disease, and 19 because it happened in November 2019. As you know, some people actually use other names to make people look bad, but I think WHO did a good job by naming it coronavirus so that people won't see a place or a country as the source of the virus. Yeah.
Okay. Good. Now, well, what kind of pathogen is it? Like what? Tell us. Is it similar to the flu?
It is not. That is basically it's different from the flu. All right, but it is a flu-like virus. All right, it causes the same symptom. It causes cough, sore throat, shortness of breath, and fever. All right.
Okay.
But it does not cause running nose. So it causes almost the same type of symptom, but it's not the flu. Right. The flu comes every year, and basically there are some mutations. So every year you need a new you need to immunize again. But this coronavirus is very new. So it's different. It's a bit different from the flu, but it is very new, and that's why we have no immunity against it. So that's why there's a lot of people get infected, and the infection gets spread to a lot of other people.
Okay, we're going to those symptoms then: fever, sore throat, coughing, and then leading to serious respiratory problems.
Correct.
How easy is it to catch this thing?
It's quite easy if you are exposed to the person which is have coronavirus. All right. So basically, when the person actually cough, all right, then there's droplets. These droplets lands on the surface. When you touch the surface and you touch your face before you wash your hand, or your face, your eyes, your nose before you wash your hand, the virus actually can be transferred from the surface to your face, to your hand, to your respiratory system. So current information is that the virus actually can last for 5 days on a solid surface. So it's a very long time.
Wow.
So you need to wash your hand before you touch your face. Of course, it's very difficult. So we need.
Yeah.
So, but the best is to don't go out now.
Mugun, let me turn to Mugun then. Mugun, can this thing kill you?
Well, the risk actually depends on primarily 80% of people who actually contract the virus have got very mild symptoms and they do recover from it. But the age group, especially the very young and the very old, as we have seen in Italy, the age groups above 70 and above, the geriatric population, they are at the most risk because they are already at risk from other respiratory illness like pneumonia and all. This COVID-19 and all just falls straight into that category.
So age is a significant risk factor.
Yes, age is a significant risk factor, and you also have to see other underlying causes that already predisposes them. For example, if you have asthma or if you have any other respiratory illness, this will just add on and precipitate the illness.
I see. I see. So diabetes, asthma, any others? High blood pressure?
All that will not, because this is an infectious disease, like you have what you have pointed out as hypertensive and diabetes, those are all non-communicable diseases.
Right.
The underlying, you having diabetes and all that, and if you're unfortunate and your health is compromised due to that, and then you have an infection, then the whole thing spirals down.
I see. So those are those can be complicating factors or mediating factors.
Yes, yes, yes.
Okay.
But the virus itself is an infectious, it's an infectious paradigm. So you have to look at it from that perspective.
Okay. Hannah, this sounds pretty serious. Are there treatments for it? Like, can chemistry help us here?
Currently, I don't.
No, let me go to Hannah on this, Victor.
Hannah.
Okay.
Oh, great, yeah.
Okay, thank you.
Hi. Okay, as we speak right now, Dr. Allen, at 6:17 p.m., there is no vaccine or drugs available that can prevent or treat coronavirus. Yes. Maybe I can share a bit, Doc, and to the rest of the audience, the development process of the vaccine.
Yes, please.
Yes, there is three stages of vaccine development, which takes roughly about 10 to 12 years. Okay, it is under normal circumstances, right? So, and it's huge process. It's very complicated, and it might cost up to $1 billion for one vaccine.
My gosh.
Thank God, we still have hope because there is a few company which has started the development, the vaccine for coronavirus. And there is one company which already entering the human studies. Okay, so the vaccine development involves 3 stages, from lab to the animal and to the human. So these processes have to take place very stringent, and we have actually candidate maybe 4 right now, which is available in the future. We hope to make it available in the next 18 months.
So, with all of those processes, then Hannah, what would be your prediction about when we would have a vaccine for this?
According to the research right now, where are we now in the development? At least we need another 18 months to get it out from the clinical trial. And after that, they need to actually go to the regulatory process to get the approval from the regulatory authority. And after that, we have to actually scale up the production in order to make it available for the whole world.
So when?
Yeah, so 18 months is very positive, 18 months. So it might take another 2 years to get it really available on the market.
Now, once it's available 2 years from now, my gosh, that's a long time, Hannah. Once it's available 2 years from now, how quickly then will it get into the pharmacies? How quickly will it be available for people to use?
There are some studies ongoing. A drug named remdesivir, which is initially developed for Ebola virus, right?
Right.
That actually only proven in animal studies. But now the company is doing a research on human to see whether this drug will also help in coronavirus. And the study began in March. Then we need another at least 6 months to know whether it's positive or it's negative. So it's still under research, Dr. Allen.
So again, that sounds like another long wait for any progress in that with that Ebola drug that was used to treat Ebola.
Yes, correct.
Okay, so gosh, what it seems like we're coming to is chemistry may not help us a whole lot here, and what we may be looking at, as our main arsenal for fighting this battle is largely behavioral. Would that be accurate?
Yes.
And what we can do then sort of falls into maybe two or three categories, and that is likely prevention, containment, and containment and mitigation, and then lifestyle. Is that accurate too?
Yeah, true.
Okay. So let's talk about prevention a little bit. How can you avoid getting this? And again, stay with Hannah for a moment. Hannah, I've read that if I triple my vitamin C intake, I'm safe. Is that true?
Okay, this is a very sensitive topic. I like to summarize the use of vitamins. Basically, the experts have done the research, and they found that the use of vitamin has little or no benefit to prevent or treat the common cold. So you can take, but the efficacy of those supplements to help you is very minimum.
Oh my. Okay. So looking then at trying to find ways to increase my own immunity to the disease, then what about probiotics? People are telling me get some probiotics and it will strengthen your immunity. What do you think about that?
For probiotics, actually basically is bacteria, is good bacteria for your stomach. And there is some study to show actually probiotics helps to reduce the number of illness, the illness episode. So from maybe 7 days of being in common cold or in flu, it reduces to 6 or 5 days. So that is the study which has shown people using probiotics can help to improve their condition.
Okay. So if we're worried about the coronavirus and COVID-19 disease, does it help now to take probiotics, or is this something I should have started doing 2 years ago?
Yeah, it doesn't happen overnight. Whatever you take, supplement or vitamins, probiotics, it doesn't mean that you take now, you can have the effect by tomorrow. It takes time to see the effect or the impact. So there's no harm. Of course, you can build your immune system from now on. Yeah, you can.
Okay. How about ginger?
Yeah. I never heard of using ginger.
I have. Boy, that's all over the internet lately.
For your immune system, but yeah, since it's natural, probably on daily basis, if you want to take, yeah, at certain limit, there's should be okay.
Like it won't hurt, but do we have any evidence that it will actually make me safer from COVID-19? Maybe not.
No, yeah.
Okay.
Whatever you take moderately. Don't pump in your body with the mega doses with a lot of vitamins, because yeah, it can actually impact your health as well if you are become overdoses of those vitamins or minerals.
Victor, I've seen you nodding as we've been talking. Anything you'd like to add?
I mean, no. Basically, I'm just a bit funny that every people trying to take supplements to improve to prevent from getting COVID. I don't think you can prevent from getting COVID. Maybe you take supplement, you stay healthy, and that might help you to have a better outcome. But that also depends on what is your comorbid condition. If your lung is already bad and something goes in, and then the only things that help actually is stop smoking, stop vaping.
Oh yeah.
That's the only thing I want to tell. All right. What you don't take that's going to help is don't smoke, don't vape, because everything goes into your lung and it would basically make your lung worse.
Okay, so smoking is about the worst thing you can be doing during this crisis period.
Yes, smoking and vaping, not just smoking. Vaping also have the same.
Vaping
problem.
also, yeah, good. How about sugar? What does that do to immune systems? Anything?
Sugar?
Yeah.
Basically, if you're diabetic, it's a problem. But if you're not a diabetic, you just become fat.
Okay. So it doesn't really affect your immune system, either pro or con. Okay, good. Thanks. Thanks for that, guys. So then prevention is all behavioral. What about so prevention for a lot of people right now means going out and finding a mask if you can find one, or sanitizing your hands with hand sanitizer, and a few other preventive items. Victor, again, is there give us your take on PPE, on personal protective equipment.
Basically, personal protective equipment is for healthcare worker who is handling patient, who is seeing patient, because that is where most droplets are generated. That's where most aerosolization happens. So you need to use a face shield, you need to use a N95 mask, or you need, so that it protects you, so that the aerosolization and the droplets doesn't fall into your face. Most of the time, people get infected, people get exposed to are basically from formite. Because when we go out, we touch everywhere, and then touch our face, and that basically is formite. So wearing a surgical mask to prevent getting COVID-19 or flu is not effective. Wearing a surgical mask because you have a flu is very effective from spreading the flu to other people.
I see.
So surgical mask doesn't help. N95, it doesn't help because it is a droplet infection. It is not a airborne. All right. It doesn't stay in the air for a very long time. So wearing N95, if you are not a doctor, not a healthcare worker, not a nurse, doesn't help.
Okay. How about Mugun? Let me go to you. How about hands? What's the best way to protect ourselves in terms of care for our hands?
Thanks, Alan. One of the key things that I've actually had to encounter with is the increase in price of hand sanitizers. I mean, they're going on exponentially. You're talking about bottles costing up to 35 ringgit to 40 ringgit per bottle, you know. So that's totally not sustainable in the long run. So if you visit CDC's recommendation for doing home-based sanitizers, what you'll be surprised is your bleach, if diluted correctly, does serve as a good disinfectant. So, you know, hand sanitizing and all that is not something that is only private to very expensive or branded sanitizers. So the CDC reports that if you take 1 part Clorox, just house bleach, and then dilute it by 9 parts water, you can actually have a hand solution for which you can actually just soak your hands or rinse it off with water, dry it off with paper towel. That's good enough, you know.
Okay.
So you know, you're talking about a 3 ringgit, 4 ringgit solution right there for a bottle of Clorox, you know.
That's really good to know because again, I've been purchasing lots of hand sanitizer, and I've noticed the cost starting to climb.
Right. Because the economic things is very, very important because it's an underlying behavioral pattern. Yeah, you know, economics does this determine how people will seek out their health-seeking behavior will be modified by it. So it's quite important to see these features as well, you know.
Okay, thank you. We're talking about preventive measures that individuals can take. There are also preventive measures that can be taken at the occupational or organizational level. We in the contact center industry became very aware of that a couple of weeks ago, and to talk about that, I'm happy to welcome my friend Lim Poyan from TBCX. PA is the general or the director, the regional director for IT at TBCX Contact Center, one of the largest contact centers in the country. Hi, PA.
Hey, everyone.
Good. PA, You know Byron Fernandez, the country director, and I are pretty good friends. And a couple of weeks ago, I was talking to him, and he was really shaken while we were talking on the phone. He said, "I just had the most incredible day," and he told me a little bit about it. Can you tell us about it? What happened? What happened that day?
Well, I think it started with news reports saying that the executive director of Khazanah, who was based in KL Central, 4 buildings away from us, has tested positive for COVID-19. And things moved pretty fast from there because I think on the next day itself, there were news reports saying that that building has been closed. So of course, I think everybody was getting worried, especially all the staff asking, how is this going to affect us? We walk past the building every day. So one of the first things that we did was to actually have a meeting in the morning. I met up with Byron and we started planning on what are the things to do. And from there, some of the things, even before that, when China announced the closure of some of the borders, we'd already taken steps like having hand sanitizers, masks available for the staff, increasing the frequency of cleaning around the office, suspension of travel, limiting travel for the staff that we have that are heading back to China for the Chinese New Year holidays and so on. So from that point onwards, from Khazanah, I think things moved pretty fast because first of all, we had to find out what it meant to all our staff. So we started having briefings with the staff to ensure that they are all okay mentally, psychologically, that they are not too worried about that. Difficult, I guess. And I think that went on to, I think 2-3 days later, there was another report saying that somebody we were asked to actually go for a briefing at Bank Rakyat. And that was where we had 3 floors. And during that briefing, we were informed that one of the directors had been tested COVID-19 positive. And one of the measures that they are taking is to evacuate the entire building and sanitize the building for the following day. So within that day or so, we literally had to actually, Byron and I had to plan and figure out how to actually start moving everybody out of that building and to, I would say, resume business elsewhere. Now, that had challenges of its own because for a start, we also wanted to actually make sure that we were not putting any of our other employees at risk as well. So essentially, the meeting involved us dealing with the building management to find out what were they doing, more details about the case. That was when I think more and more details came out, as in, for example, the director was normally not based in that building. They have a private lift that they use. It's on a totally different tower from the ones that we use on a day-to-day basis. Being a director, he probably doesn't have meals the same place where our agents do as well.
Wow.
And one thing that helped also was that a lot of our agents bring their food to the office. Okay, we have microwaves for them, so they heat their food up in the office. So the chances of them interacting with the director was remote. Of course, you cannot be too sure because it is one building with 2 towers. So, but anyway, moving on to moving the people out. The first thing that we did was to find out, where can we move people to? At that point, I think some of the projects we were already doing a 50-50 separation to minimize the risk. So in a way, we had to focus on close to 600 staff that had to actually move from there elsewhere. So we started allocating spaces there. I had tremendous support from our IT and facilities team that actually made sure that the infrastructure was ready. We started doing testing to actually move operations over to other sites and basically getting cooperation from the other operations to maybe just separate spaces and start to move people. Yeah.
What a massive undertaking! That must have been just incredible. How did you feel during this? Like what was going through your mind?
Well, I guess it wasn't the first crisis that I've had before. it would be the first crisis of this nature. I'm not that young, but I think I am. It's basically the first pandemic that I've actually had to deal with in Malaysia. In a way, with everybody already being worried, I guess I took it upon myself to actually be calm. And again, I've been following the cases very closely, and I think I echo some of the things that Victor and Mugu has been saying as well, because I think people just have to be more informed, and instead of pandering to a lot of the social media posts that were going on, I relied a lot more on, I guess, broadcasts from the Ministry of Health, what I could get online on the facts of coronavirus. How does it spread? As Professor Victor said, face masks don't help. Okay. Having said that, we did get sufficient face masks to provide to the staff, but of course that's starting to actually get painfully low because since then we've not been able to get any. Hand sanitizers are still sustainable. But I guess in a way, most importantly, not to panic, get the facts. And with Byron, we started going floor to floor, talking to the staff, finding out how they felt, and telling them the facts that we know. Why not to worry, and what are the steps that we are taking? Things like increasing the cleaning frequency. When move ahead maybe 2 weeks, then there was a case that somebody from Cisco was infected by the case as well. So by that time, I think we found that different buildings have different approaches to it, all within the auspices of the MOH. But where Bank Rakyat chose to close the entire building and do the disinfection of the entire building, One Central chose to do only the floor that was affected. So we started making arrangements to talk to the people who did the disinfection of Khazanah and also Bank Rakyat to come to our office and take a look. And that's when we started disinfecting our offices on our own as well. So I guess these are some of the steps that people can take.
Very interesting. Very interesting. Mugu, any comments? Mugu.
Most important is just the entire behavior component and how all of us have to come together. And there must be this subset, almost like a nucleus-like authority, who is giving out correct information, who becomes a source to give valid information. So we do not take anecdotal instances or anecdotal ideas like the one that we had about probiotics and vitamin C. And you need to be really, really discriminative about your source. And right now, the Ministry of Health, WHO, the CDCs, they've got really good sources and really readily accessible. People need to always refer to that, and do not take in all this anecdotal evidence as facts. That's very important.
Great, PA. Thank you very much for dropping in. Really appreciate the account, and I think we can all learn from the experience that TDCX went through. So thanks, bro.
Very welcome. Stay safe, everyone.
Thanks you too.
Okay, thank
Stay
you.
home.
Well, some of the things that the PA was talking about were very interesting, and I want to dive into them. But first, let me see if we got questions. Asha Moen, our technical producer. Do we have any questions from viewers?
Hi, Alan, and everybody. You guys can hear me loud and clear?
Yes, we sure can.
Okay, I've got two questions now. First, from day 3. If the vaccine takes 18 months to be produced, if that's the right word, how are people being cured as we speak? Is it, are they recovering? What's happening with the people who are coming out of hospital?
Well, that's a really good question, because every day we do see recovery statistics that are being reported. If there's no treatment for these people, how are they recovering? Victor, you want to take that?
Oh, okay. Thank you very much, Alan. I think that's quite an interesting question. Basically, it's a virus. All right. We know for the facts that most of the time virus we don't need treatment. All right. We just need support. All right. So basically, what they're doing in the hospital, they are not giving them anything, or they're giving them some support in the form of medication to support to their lungs and support to their health, so that they can go out of it. Your human basically is a virus, so basically we develop immunity to it, and then we just cure by ourselves. That's why those people that have poor immunity will succumb to the disease. Those people have not so bad, good immunity, then they will basically come out of it. As mentioned by Murugan just now, that's 80% of us don't have any symptom or don't really go to hospital.
Okay, so in a lot of cases, then we're curing ourselves. It's our own immunity that is making us better. We just have to behave in the right way with rest, and then make sure that we don't transmit the pathogen to other people. Is that what you're saying?
Yes, that's what I'm saying. I think that's the only thing we can do. All right.
Okay.
At this point.
Thanks very much for that. That really helps. Asha, another question.
I've got one more for you. Say somebody in your proximity is diagnosed, if that's the right word, today that they are COVID-19 positive, but they were in office and they were with you for the past month, yesterday, maybe even this morning, but this evening they were declared positive, yeah? If positive is the right word for it.
Yes.
What should we do? How do we go about protecting the rest of the people with us, ourselves? What do we do with that?
Wow, another super question. Mugu, you want to jump in on this one?
Sure. Could you just help me repeat the question again? I've been reading some of the questions that are coming up here.
Okay, right. So the question is, say the six of us are together right now, and we were all right yesterday, and then today just before 4 o'clock, I go to hospital because I'm feeling a bit ill. I go to hospital and they tell me I've got COVID-19. So what do we do? What do the rest of the five of you guys do to ensure to protect yourselves and the people around you?
The first thing you got to do is you actually go back to the criteria of triage that we usually do. If you have come in contact with a person who's a confirmed COVID patient, then automatically you have to self-quarantine because you are now a carrier, even though you're not showing any symptoms, and you have the risk of passing it on to someone else. And that's where all the measures comes in, because you need that 14 days recovery. That's how long the disease will take and the time your body needs to actually develop. You might not end up having the symptoms as another person who needs hospitalization and support. But during this period, you are a person who can be deemed as a carrier and you can infect somebody else. So if that other person that you're infecting comes from a risk group, for example, your grandparents who are 70, 80 years old, then they, due to that exposure, might develop fatality. So this is how you got to interpret the event. So you are already a carrier and you have to quarantine yourself.
Okay, so self-quarantine first. And then
you're asymptomatic. That means you're not having any other symptoms. You quarantine yourself first, and the symptoms will kick in. If the shortness of breath, the fever, the cough, all that will kick in. At that point of time, you reach out and you'll be monitored to see whether you need tertiary level help or hospitalization as a support while your body fends it off by developing its own immunity.
Okay. Now, at that point, then the person who has been declared COVID-19 positive has undergone some testing. Should I undergo that testing while I'm in self-quarantine also, or can I? What's the availability of testing like in Malaysia right now?
You can, but the question you got to ask is, let's say now you test because there's a period where you can actually the test will come back positive. So if let's say now the test comes back negative, but you still have been exposed to somebody who has COVID-19, do you not quarantine yourself? Do you go out? No, that's not the issue. You still have to quarantine yourself.
You still have to self-quarantine.
Because we don't know when the testing will turn positive per se. And the cost of testing, if let's say right now, if you're going to be testing directly for what we call the virus itself or the antigen, it's really expensive. You're talking about 700,000 ringgit.
Jeez.
Yeah. So because you're directly testing for the antigen itself. in the preliminary.
Okay, now, so is there any work being done on providing a test that that is a test that is less expensive and that we can actually do ourselves? I mean, I mentioned I have a diabetic condition. Testing for hypocrisy is pretty easy every day. And are we working toward anything? Are we working toward anything?
Sorry,
that will.
Sorry, Alan. Before that.
Yeah.
Before that, can I add something? All right.
Yeah.
Just to make it clear, because I am managing University Malaya Medical Center, all the healthcare workers there. So we have 3,000 healthcare workers. Basically, they are exposed every day. All right. So if you have exposed to a patient who's confirmed to be, or your friend confirmed to be COVID-19 positive, all right. First thing you have to do is you have to call your PKD, all right, or your pejabat kesihatan daerah.
Okay.
Tell them that you are exposed, so they would review whether you are considered a contact or not. If you're considered a contact, they will follow you up. If you're not considered a contact, then they will just tell you you're not a contact. But in the meantime, as mentioned by Mugu, you have to self-quarantine. Self-quarantine means you stay in the house, and if you have family members in the house, please wear a mask. All right, use a separate toilet, because then you don't want to basically contaminate the rest of the house for your other family members. So if you alone has been exposed, and you don't think your family member has been exposed, then you stay in your own room, stay in your own toilet, and then the food should be provided for you. But the first thing is that to make sure that you don't feel what you call that stress and things like that. Call your pejabat kesihatan daerah, mention that this person has been confirmed and what should I do? Then they'll basically question you whether you are a contact or not. If you're a contact, then they would do whatever they can do. So if you're a contact with a COVID, the test is free. All right. If you consider contact with COVID, the test is free. But if let's say you are well, all right, you're just worried well.
Yeah, me.
Yes. And then if you want to go for a test, it's 1,000 ringgit.
Good God. Yeah.
Yes. Why should you go for a test, Alan?
Because I can't sleep, Victor. It's but I get your point. I get your point. Are we making any progress into other forms of testing? Is there any way of making it more personal, easier? Mugu, help us on this. Any new developments?
Okay, we have rapid test kits and for screening purposes and all that, but they have to go through the due diligence. I was at IMR earlier this morning, where we were actually submitting some of our test kits that have actually been developed in South Korea. So, but you need to go through the final stages of testing, because the test kits and all that are screening. And these test kits only pick up once you have developed your antibodies. So they are day 5 and above. That's when your antibodies, essentially your IgM and IgG comes out. So these are all screening measures, but that will help. But you must understand that screening measures are not confirmatory testing. They're two different things. Yes. So everything has to go back,
yeah. So the simple devices are for screening. The more complicated processes that Victor was talking about are for confirmation.
That's what you're testing. So what Victor was telling is absolutely important. We really need to understand who do we get in touch with, and then follow their algorithms, follow their advice, and that's the way to go about this correctly.
Okay. Victor, walk us through that process again. Who do we phone or who do we text? Where do we get a hold of them?
So depends on where you are, all right?
Okay.
So if you are in a district, call your district health office or pejabat kesihatan daerah. Basically, if you are in Kuala Lumpur also, you call your pejabat kesihatan daerah. So don't go to a hospital, please. Don't go to a hospital because they are overwhelmed. Call your pejabat kesihatan daerah, mention to them that you are exposed, and they will come and see whether you need to be checked or not. So they would advise on you, your pejabat kesihatan daerah, or what we call district health office. So
district
health office, even for Kuala Lumpur also have a pejabat kesihatan wilayah persekutuan dan Putrajaya.
Okay.
Right.
Thank you very much.
So the number you just Google on KKM website, you will find the number. Call them up during office hour, and basically they would basically try and tell you that okay, you are a contact or you're not a contact.
Okay. Thank you. Let's talk about screening tests. And one of the things that, well, let me tell you a story. A good friend of mine is a CEO for a contact center, another large contact center in KL. He wanted to institute some screening tests. He had a major argument with the real estate management firm that manages the building that he's in about whether or not he could set this screening up in the lobby. Finally, he did so on his own, and surprisingly, he ran into an awful lot of resistance. People angry at the inconvenience, people angry because it made them feel uncomfortable, some concerns about personal privacy, and at one point he was even accosted in the elevator by someone who was angry, using bad language. My guess is that this kind of anger, this kind of resistance is something that we're going to see more of as time goes by. What is your advice on how to deal with it when it happens?
Me, is it?
Yeah, anyone.
I'm not a psychologist, so I can't really tell you how to do the what. Maybe Alan, you are familiar with that.
Yes, yeah. I guess what I'm thinking of is when we go to when we go through the process of actually setting something up that's aimed at protecting people in an environment, and people get really angry about it. They get resistant about it. They don't want to buy into the process. The way that some people are even reacting to the movement control orders that the government has provided. As a public health professional or as a primary care physician, what advice can you give us in terms of how to deal with those kinds of feelings, those kinds of attitudes?
Okay, that is better. All right. Basically, if you're, the issue is that we have not explained clearly. You understand?
Okay. Yes. Yeah.
Information have not been communicated. So if we just do things without even consultation, without even telling people why we're doing it, and we just do it without clear reason why we're doing it. So the thing is, why did movement control order came into effect? It's because the public are not listening, are not trying to help by having social distancing themselves, having voluntary social distancing. So what is happening now, according to my friend, my professor, Professor Awang Bukiba, basically it is called forced social distancing. So basically what we're doing now is, by having movement control order, we're having forced social distancing. So everybody's angry because everybody don't know why we're having it. We should have spent some time to basically explain to people, maybe have a forum on a TV, and then speak out before we actually implement it. So that would be a better thing, because we are human beings. We don't want to be told what to do without understanding why we are doing it.
That's right. I couldn't agree with you more, Victor. And even at our university, you wouldn't believe the amount of discussion that went on in various WhatsApp groups between researchers, just trying to figure out what some of the directives actually meant. They talk about closing universities. Does that mean the campus is off limits to anyone? We didn't know that for a long time. There was some confusion about where you could drive and what you could do. Could you pick up your children? Those kinds of things. And we're sorting those out. Those are being sorted out gradually. But I think you're definitely right that in that confusion is what leads sometimes to a refusal to comply. Would you agree, Mugu?
Yeah, totally. I think it's important. I mean, even in the primary healthcare setting, or when we actually set up a triage in any of the hospitals and all that, all the ability to communicate what you're doing and having it more as an invite actually reduces the confrontational elements of where you cross over and say, look, you got to do this, you've got no choice. That really backfires all the time.
Okay. Okay. Very good. Thanks, guys, for that, and excellent discussion. Let me go back to Asha, because I noticed as we were talking there was another question that came in from a user in Sarawak. Can you read Helen Abdilla's question? Asha.
Yeah. Hang on.
Yeah.
Helen's question. I need to scroll back. Sorry. Hang on a second.
Okay.
Okay. So we're talking about stuff that our grandparents maybe have told us.
Uh-huh.
Yeah. So say in a pandemic like this, would natural stuff like say garlic or ginger and stuff like that, boiling it, doing stuff with it, steaming it, and then breathing in the air, would that make a difference? Would that benefit us?
Okay, so boiling ginger or garlic, breathing the steam from the boiled product, will that prevent?
Would that help? Would that?
Yeah, will that help?
Yeah.
Take that one, Hannah.
Basically, we go back to the clinical evidence. There is no, I believe, no concrete evidence that those will help, but maybe psychologically, if they help. So yeah, you can continue doing.
So it won't hurt, but it's probably not going to keep you any safer.
Yeah.
Okay. Okay. Thanks. That's a good answer.
At least, Prof. Victor can comment as well.
I think it makes you feel better. Correct. Anything that makes you feel better is good. But besides doing that, you need to have social distancing. You need to wash your hands.
Right.
When you're sick, wear a mask. Don't get infected. Anything that makes you feel better, do it.
Yeah.
There's no harm. Correct.
I love that answer. That's right on, because we also have to keep in mind how people think and how people are feeling during this crisis too. And if there's an approach, a method that they've used to cure or to feel better and with other illnesses, definitely use it. There are a lot of suggestions like that out there. Most of them online on the internet. A lot of them on Facebook. One thing I was reading on Facebook, Hannah. One thing I was reading on Facebook was if the virus is very sensitive to heat, and that heat at certain levels can destroy the virus. It's suggested that if I drink a cup of hot water and stand in the sun for a couple of hours every morning, I'm safe. Any truth to that at all?
We try to actually find research on that, the relationship between temperature and virus, but there is no clear evidence that the virus can be killed at certain temperature, or even can be killed in the cold weather or extreme hot weather. We don't have any real evidence that will help to prevent the virus from growing.
Okay.
Ellen,
thank you.
Ellen,
yes.
Yeah. I think if you stand in the sun for an hour, you get skin cancer.
Yeah. Let me ask Asha. Is it possible for us to go over a little bit?
Yeah, go for it, Doc. We're good.
Okay, so we can go as.
Hang on, Doc. Sorry. There's one question that might be interesting to answer. How what's it like for relapse for a virus like this?
By relapse, do you mean that if you get it and you recover, can you get it again?
Yes, unless the virus itself manipulates itself and becomes something else. There's a word for it. I'm not sure what that is. But say the one that we have now, COVID-19, can you relapse? Okay,
I'll bet you right from the start we don't know for sure yet. Let me throw that question at Mugu. If I get COVID-19, if I contract COVID-19 and I recover, as Victor talked about with my own immunity, and I become COVID-19 negative now, and then I'm exposed to another infected person, can I get it a second time?
Technically, the way virus works and the way your immunity works, the answer is no. You should not be contracting it unless the COVID-19 has mutated into a different strain.
Right.
Okay. So in the absence of a mutation, we're probably not going to reinfect.
Difficult. The theory doesn't
Okay.
work.
Okay.
Okay.
Concur, Victor?
Thank you.
I think, yeah, agreed, Mugu. Yes. If not, then vaccine doesn't work.
Exactly, and the other thing that doesn't work is the plan that we seem and a lot of countries seem to be following in terms of flattening the curve. I hear that terminology an awful lot. Mugu, can you explain what we mean by that? Flattening the curve.
Well, you have a situation here where you have to understand what is an exponential curve, I guess. Let's say now, for example, everybody is going to look at taking $1 to the bank, and within a week, the dollar grows to 100 ringgit. That's pretty much an exponential thing. So you're quite happy if that happens to your money. You're not quite happy if that's what the number of patients going to be with a disease over a period of a week. So flattening the curve essentially means to ensure that new cases and all that taper out. So that's like putting a fixed deposit into a bank, you know. So that's the best analogy that I can come up with for people to understand what it means when we are trying to work hard to flatten the curve. And again, it goes back to social distancing, paying attention to washing your hands, ensuring that the droplets do not get contaminated over, disinfecting surfaces because you've got a lifespan of 5 days, like how Victor explained this now. You know, all this is important, and that sense of vigilance is crucial to flattening the curve.
Okay, that makes a lot of sense to me, and it also gives me some comfort in the way that we answered Asha's last question. It would be a lot more difficult to flatten the curve if people could get reinfected. But it sounds like if you're infected and you recover, your chances of getting reinfected are almost nothing. So it is possible to make the growth curve flatter.
Alan?
Yes?
The reason we are trying to flatten the curve is that because our healthcare system is overwhelmed. Now all the healthcare, let's say in Sungai Buloh itself, they are not treating any other patient. They are only treating COVID patient. So people with other diseases are not getting treated because and we have not enough healthcare. So to flatten the curve means we want to prolong the disease until we can find a vaccine. So everybody would basically, if we can prolong it for 2 years and then the vaccine is here, so the less people get it. So by the time the vaccine comes, everybody would be immune. But if you have it like what we're having now, our healthcare system is basically overwhelmed with patients. We are facing this problem in University of Malaya Medical Center. Every day we're having meetings to make sure that everybody is well enough to come back to work.
Wow. So really what we're doing at this point, we're buying time until some of the some other measures can be developed.
Yes, I think we are not buying time, and also we are making sure that if there's infection, there's people getting sick, they not so fast they get sick, so that the healthcare system can manage it.
Let's get back to talking about contact center management for just a few minutes. Each of you, can you tell me the 2 most important occupational health best practices that a contact center can be engaging in right now? What are the 2 most important things for team leads, managers, quality assurance people, and general managers to be implementing right now? How can we keep the environment safe? Hannah, you start off. What would be your 2 best suggestions?
I think the first thing that we need to take care of employee, we have to make sure that they are healthy. That's the first thing we need to do. And secondly, we need to also look into the plan, how to actually to reduce the number of people coming to work, knowing that we are in the healthcare industry, that we need to continue giving our support for our services to the country. So we have to have in plan how to actually help our staff to work from home. Yes, I think that's the 2 things that we need to look into.
So very, very good. So reduce the number of people coming to work.
Yes.
And then also be concerned about the basic health and conditioning, health and well-being of our staff, not only during the crisis, but prior to and after. Yeah. Okay, great, thank you. Victor, what else can we do? Well, what other two best practices could you suggest as an occupation?
I think because now a lot of our people are actually at home, correct? Nothing to do. All of your workers are at home, got nothing to do. You need to offer psychological support. All right. If let's say in a hospital where you need to the nurses need to work, the healthcare workers you need to work, then but the nursery are all closed, correct? Where do you send your child?
Exactly.
Where is childcare? If you are worried about your child, how can you come to work? So although the nursery are closed, we should be able to provide some kind of childcare services that are safe, so that the workers can concentrate on their work and don't have to think of other things. So psychological support is very important in this.
Excellent. Yes. Wow. Mugu, how about you?
I guess, when I totally agree with Anna about having better work from home setups and all that, I think that really helps. And then also in terms of, provisions that where you have medical leaves, so paid medical leaves and all that, I think is a very important social consideration as well. So that might be able, right now we only have sick leave if the person is sick. So here you might have people who have, maybe that can be expanded, and corporations that can look at expanding the coverage to not wait until people are sick, but if they are exposed, that also gets covered, but they can work from home. All that will seek to elevate. And in the workplace itself, you need to do some kind of triage, simple things. When people come there, exactly what we are doing at hospitals and all. You take their temperature, you have a small questionnaire,
Okay.
the office buildings and all that, a triage point might be a permanent fixture during this period.
Okay. How about business continuity planning? How important is Mugu? How important is that to the survival of a company at this point?
I think that's really, a lot of companies and are just waking up, I guess, like all of us, that our supply chain is all so fragile and so interconnected. It's going to take a whole re-engineering of a lot of our business values, where we are getting our supplies from. That is, I think, the challenge and the aftermath of COVID-19, and we can actually cross that horizon. You will see a lot of changes in that, that requires a lot of leadership, especially at the political level. I don't see that coming forth very strongly right now.
Hannah, how about you? At Fairhaven, do you have a business continuity plan, and is it kicking in now?
I agree with Mugu that we have the impact will be on supply chain, because we supply and we manufacture the drugs for the entire nation. We have to ensure that the product is sufficient. We have sufficient stock. Supplier can continue to supply the products to us so that we can supply to the hospital and clinics. We have to look into the supply chain. For example, in this case, we need the active pharmaceutical ingredient from China and from India and from the rest of the world. Because currently, the active pharmaceutical ingredient is not being manufactured in Malaysia. We have to rely on those countries, especially in China and India, to get the raw material. So our supply chain have to work hard to ensure that there is no interruptions of the supply of this ingredient, to do the forecasting, to do the planning, very detailed, to ensure that we are able to supply for the product for the whole country. Yes. That's the challenge.
Wow, that's massive.
Yes.
Yeah. Great. Asha, any more questions?
No, Doc, we're good for now.
Okay, good. Well, in that case, then let me take the panel in a
sorry,
different...
Doc. One just come in. How far has this pandemic impacted our current economic status, as a one-to-one between a company and, say, a retailer? Has it affected? Would anyone know?
Mugu,
But
that
in
sounds like a
Malaysia or
question for you.
globally?
That sounds like a question for you, Mugu.
Let me make sure I get the question right. She's asking whether there is any impact on the retailer versus
economic impact in general. Malaysia
Overall
and
economic
globally.
impact.
Yeah.
You know, in all kind of cases, you will always have, in this kind of situation, you always have winners and the losers. But I think the losers in this scenario that COVID-19 is producing is staggering. There's a lot of people who suddenly find that they are unable to function just because of, look at all the event-based companies, hotels, airlines, you know, the industry, it's swiping down on industries, and these industries need to be able to have holding power. Most of them will not. The small, medium enterprises do not have, you know, piggy banks or bank cash stashed away, you know, to weather this. So, and then the repercussions will boil down. You know, you know, the disease will fade off, but the economic impact will be felt long after that. The aftermath on the economic field will be far and wide.
So it's going to be a rough ride for a while, economically as well as medically.
Yeah, because we've got to get everything challenged. So just 3 days ago, I was listening to a segment on BFM, and they were looking at how in contracts, in simple contracts, the clause of force majeure was put in as an afterthought. Now it's actually coming to the forefront, you know, and how do you interpret that clause? And how Malaysia's legal system is framed along force majeure is mind-boggling, because it's not all of us have come across force majeure in our contracts, but to see it apply, you know, right now they're looking at seeing whether pandemic has to be specifically placed into a force majeure event.
Yes.
So you're having all these problems that we've never even considered to think about before.
Contracts are defaulting. Service level agreements are changing overnight with work from home requirements. The spending power of people, just in terms of turning to retail, the ability to be entrepreneurial. All of these things are affected hugely by what's going on right now.
So I don't think you can just single out and say retailers will not be affected. I think no, everybody will. It's you know, it's how we pull together as this is where compassion and everything comes in. I mean, at all levels, you cannot just hide behind an institution and say, oh, it's not my problem. If you're a banker, you have to have a compassionate ground to understand what this person is going through. If you're a retailer, if you're running a school, if you're running any business entity, this is where compassion really comes in. You know. I don't see us being able to get through this without our humanity intact if we are not compassionate.
Mugu, can I ask a question?
Sure.
So do you think the business model that we have now will change? Do you think the economic model we have now will change because the whole world is affected now?
Yes, it will change, and my fear, honestly, Victor, is that you will have individuals, especially at the political level, who will skewer it and take advantage of it. You know, that's my problem. You know, that's usually my problem. You see, like all the supply chains and everything have been handed over to China, not for fun, because it was economically feasible to produce products at a lower price when your manufacturing and elements will be at a lower cost. So you scout the world to see that. But now what will happen is people will say, look, when you do an audit for a company, you might see in the audit report a supply chain report coming in as well. So you will be able to see the impact of supply chain disruption on your profit line, which is not something that you will see in any of your. You won't see this in any of your annual reports when you attend any shareholders meeting. That might change, and you might have the big accounting firms starting to have that as a disclosure. So yeah, the landscape on the economic front and business front, to me, will change.
So how are we going to face it?
I think by being aware, like for example, let's say now you take something like in Malaysia, some of the things that you like that we control 100%. Like I was talking to my wife yesterday, some of the things that we control 100% would be like tea. You know, Lipton tea. We grow it in Cameron Highlands. We manufacture it there. We package it. We package the thing. So the supply.
Bo. It's bo tea. Sorry.
Yes.
It's not
Bo
Lipton.
tea.
Bo.
Sorry. Bo. Yeah.
Yes.
So,
Lipton doesn't belong to us.
Yeah, true. Bo, sorry. Been to that plantation, really love it. And what happens is the entire supply chain is ours, correct? But that's not the case in every other field, in every other segment, correct? The supply chains run back and forth across the globe. You know, you had, unfortunately, somebody like Trump who came and weaponized the supply chain. Now you have COVID-19 comes and actually rip apart the supply chain. So it's at the forefront of everything that we're doing. So when we go into a business now and we're planning, supply chain becomes very important because people will ask, where are you getting your raw materials? Do you have 2 or 3 suppliers for the same raw material? Are all of that coming only from one region? You know, these are questions that even bankers might start to ask when they're trying to price in an interest for your loan.
Let me keep you on the hot seat for another couple of minutes, Mugru, because building on Victor's excellent question about the will the business model that we have changed. I've heard you speak publicly before, and you've made the comment that primary healthcare has not changed substantially in the last 100 years. Do you think that healthcare is going to change significantly? That we have a new model for healthcare as a result of this crisis?
Well, let me qualify that, Ellen. Most of the primary healthcare physicians are doctor-centric. That means people have developed a trust for the doctor, and they come to him when they are ill to find a fix. What I say when the relationship is going to, what is going to change is the relationship. The reason why you go to a doctor, you want to go to a doctor to preempt situations. You want to go there to have the doctor as your coach to help you stay healthy, not to help you recover after you fall sick. So it's the preventive component that I think is going to become more and more important. Patients going to doctors, regardless whether it's primary healthcare or not, because that would be their first port of call. But they're going there to say, Doc, I'm coming to you, not for a diagnosis. I'm coming here because I'm healthy and I would like to stay healthy. And how can I do this?
So a greater focus on well-being than on health.
Yes. And honestly, that's where I think you should use your doctors. Doctors should be used to help you prevent because we are well trained to do that. We have this ability to prognose on your disease. We have the ability to evaluate your risk factors, but it means that you have to be proactive in your health-seeking behavior. You have to come to us when you're healthy, not necessarily when you have to drag yourself out of bed because the symptoms have overwhelmed you.
I can't agree more with Mugu because with COVID, you go to a doctor. What can a doctor do?
Yeah, exactly.
So if you're healthy, then you have a better chance. But you cannot be healthy now. You got to be healthy before now. It's too late.
And if that's a change that we're going to see in primary healthcare and healthcare and medicine, do we see it also in pharmacology, Hannah? Do you see a greater focus emerging out of this crisis on finding things that we can add into our body that make us healthier, rather than always being a science that cures disease?
Yeah, maybe things will change, that people will start to look more and more into prevention, to have a healthy lifestyle, and promoting a healthy lifestyle start with individual, I think. So we have to, we can see, we may see in the future that people starting to take care of their health more, eating healthy food, being active, or avoid all those alcohol or processed food and stop smoking. So that might be a change in lifestyle for the people. That is for sure, I think.
Okay. So we'll see lifestyle changes again, supported by the pharmaceutical industry and using doctors in a different way.
Yes, and at the same time, I think pharma industry has to look into, like in this case, we have to see how our development process can be expedited in finding new medicine or new cure for those diseases or for those new viruses.
All right, Dr. Allen and everybody, we need to close this down now. We've gone past the time. Thank you very much, everybody. Dr. Allen, I'll give it to you to do the closing here.
Okay, thank you, Asha. I think there are ample takeaways. I think that there are a lot of things. Gosh, we've covered everything from hand washing to the global economy, and I think it's one of the best discussions that I've been in a very long time. Recognizing the clock, as Asha suggested, I think it's time now to thank our panelists, Nurhana Nawawi Suri, Professor Victor Ho, and Dr. Muguntan Murugan. Thank you, guys. You've been a great panel. Let me also make a couple of comments in closing. First, I'd like to thank everybody who participated in the panel tonight. Your questions were thoughtful, and I only hope that you have found this useful. As a final takeaway from me, what I would like to do is just spend a moment commenting or referring to or expressing how I feel about all of those people who are now working on the front lines to combat this. People at the district health centers, people, members of our association who are working at call centers like with Hannah, or at International SOS, where they're dealing with some of the scariest and most difficult issues that they could. Some of your graduating students, Victor, and some of my students that have graduated who are there making some really difficult decisions, either in terms of public health or in terms of management of organizations. The work that you're doing, Mugu, and others, looking at innovative technologies that are going to help us get out of this morass. To all of those of you, particularly the community health center, the district health center workers who are going now, I believe, about 14 hours a day, doing their very best to identify cases and to follow up on contagion. To all of you, please accept our humble thanks and our gratitude for your bravery, your wisdom, your professionalism, and your commitment to the country. I really mean that. With that, then, let me finish by reminding everyone that this is a production from the Contact Center Association of Malaysia. The whole webinar program has been a priority of the association president, Mr. Raymond Devadas, from Day 3 Business Services. The organization within the call center association that's responsible for this is the community relations pillar, chaired by Sharanjit Kaur, also from Day 3. The technical production today was provided by my co-host Asha Mohan, the manager for CCAM, and we very much thank Lim Guayan from TDCX for driving by, and as always, my partner in these webinar programs, Ms. Sophia Soon from Maybank. The executive director for CCAM is Mr. Ken Hernandez. With that, then let me thank all of you for tuning in, and wish you a very good evening, and asking you to please stay informed and please stay safe. Thank you and good night.
Thanks, Alan.
Good night. Thank you.
Good night, everybody. Thank you.
Bye. Good night.